Victoria Balasani, and her topic would be why not to miss refractive amblyopia. Dr. Balasanyan, please.
Good morning, dear colleagues. First of all, let me to say thank you for the organization, for the invitation. And today I would like to tell you about what can be hidden behind seemingly ordinary refractive amblyopia and how not to miss the underlying diseases. No conflict of interest. Uncorrected refractive errors are considered the most common cause of amblyopia. According to AIOS, there are two main types of refractive amblyopia, and severity of the refractive error and amblyopia are directly related. Behind the mask of high refractive error and amblyopia, more serious eye diseases can often be hidden, such as congenital eye abnormalities of chorioid, vitreous body and lens, inherited retinal disorders, congenital optic nerve and macular disorders. And it's very important not to miss this condition and the onset of progressive inherited diseases. A comprehensive examination of the patients is essential for an accurate diagnosis of amblyopia. All patients with amblyopia should undergo not only a standard ophthalmological examination, and I'm sure that most doctors will agree that even when we are absolutely sure of the diagnosis of refractive amblyopia, a routine ophthalmological examination is not enough. In our clinical practice, whenever possible, our patients with amblyopia undergo electrophysiological examination and OCT in order not to miss concomitant serious diseases. The use of OCT makes it possible to diagnose diseases that are not visible during a routine examination of the fundus, especially hereditary and congenital diseases in the early stage. Conducting visual evoked potential is necessary to detect it, meridional amblyopia, optic nerve atrophy for an objective assessment of treatment result and dynamic observation. And so I'm sure, sorry, okay. And dear colleagues, let me show you using several clinical cases as an example why it's so important to carry out additional examination and why the previously mentioned methods are included in the standards of examination of a patient with amblyopia in our clinic. The results of the ophthalmological examination are presented on the slide. You can see hyperopia 10.75, astigmatism more than 12 dioptries. Best corrected visual acuity on the right eye was 20/60, on the left eye was 20/40. Cycloplegic refraction and examination results correlated with the diagnosis of refractive amblyopia. And as you can see on the slide, OCT also showed normal results. But in our clinic, a patient was prescribed glasses and then started pleoptic treatment with permanent alternating occlusion of the right eye and the left eye, of course, taking into account the difference between the visual acuity. And so after one course of treatment, we got the following results. Visual acuity on the right eye increased to 20/40, in the left eye to 20/30, you can see on this slide. And despite the fact that OCT showed normal results, since the patient has high hyperopia with axial length about 19 millimeters, and we know that OCT usually doesn't take into account the influence of the refractive errors, especially of a high degree, on quantitative measurement of fundus structures, we supplemented the previous examination with electrophysiological examination, visual evoked potential, and electroretinography. The results of conducting examination can be viewed on the slide. Visual evoked potential showed only functional signs of slowing down the time of the nerve impulse along the visual pathway, and according to the ERG, signs of pronounced dysfunction of rod photoreceptors were observed in both eyes, as well as moderate suppression of the bioelectric activity of the central parts. Taking into account the results of the electroretinography examination, the patient was recommended to undergo genetic testing to confirm or deny chondrodystrophy. And what we see, genetic testing revealed two types of mutation. The first causes chondrodystrophy type 2. Mutation in the second gene lead to the development of retinitis pigmentosa type 40. Further plan in this case for patients is dynamic observation together with ophthalmogenetics, and as you saw previously, we received good results after vision therapy, so we will continue to treat amblyopic cause of reduced vision. The next patient, 5-year-old boy, was referred to our clinic with diagnosis refractive amblyopia, mixed astigmatism for vision therapy. Despite the fact that refractive error is quite similar on both eyes, in this case seems like regular refractive amblyopia. But examination shown that best corrected visual acuity of the right eye and the left eye was significantly different. Eye fundus examination of the left eye revealed huge macular chorioretinal oval atrophic lesion. Patient was recommended to undergo OCT and web examination, and what we see, OCT reveals that retina without any visible structural pathology, mostly normal thickness, and on the left eye changed according to the type of chorioidal coloboma. According to web result, in the right eye there are no electrophysiological signs of visual pathway dysfunction were detected. Nevertheless, in the left eye, electrophysiological signs of severe visual pathway dysfunction were found. As the retina of the right eye is preserved, patient was prescribed to undergo vision therapy courses. We also tried to treat left eye. After 3 courses of pleoptic treatment, amblyopia of the right eye was eliminated, and on the left eye we also see good results. We also have reached improvement in the vision, and so the refractive amblyopia took place in this case also. And our last patient, 12-year-old boy, admitted to our clinic with diagnosis of refractive amblyopia, high hyperopia, hyperopic astigmatism. Examination shown that best corrected visual acuity on both eyes was very low. And we conducted fundus exam and OCT of the retina, which shown normal results. Visual evoked potential and electroretinography revealed slight functional change in the optic nerve and retina. And in that case, we decided to start with laser correction of refractive error as the first step of the patient's treatment in order to create optimal condition for further amblyopia therapy. And after a rehabilitation period, patients started vision therapy courses. So there were 3 10-day courses during 1 year. And at the end, we got high visual acuity result. Amblyopia on the right eye was eliminated. And so for the plan for this patient of treatment to continue vision therapy to treat amblyopia on the left eye. And that's it. So dear colleague, what we want to say, okay, that even we see the refractive error, which should seems to imply the cause of refractive amblyopia, it's important not to conduct the more detailed examination, conduct additional method of examination, which we say, and refractive anomaly also plays role in visual function, and we should not refuse to treat amblyopia, since even with serious underlying condition, there is still a chance to increase visual acuity and improve the patient quality of the life. Dear colleagues, thank you for your attention.